on its face, it doesn't seem like it's going to be much. We might just see some small movements happening, maybe some loss of some companies, and we don't really see that affect us in the short term. But the long term, again, I think goes back to the fact that if we don't have access to a robust amount of medicines with really open marketplaces that allow for these companies to compete at a grassroots level, at a large level, at a medium level, I think that yes, I think at the end of the day, it's patients that end up suffering. We're going to see a consolidation of players in the market, which is going to squeeze out smaller players who might not be able to afford to play in this space. Again, that is going, all of the costs are going to be forwarded onto the consumer. And that obviously leaves them with less access to medicine.
Adam Sos here for Rebel News, and the Liberal government is set to foist Bill C-47 upon Canadians. It is a bill that would add a lot of red tape and regulation to the access and distribution of natural health products. Over 70% of Canadians use some form of natural health product, whether it be to help with their immunity, help with sleep, help with stress, whatever it may be. Natural health products are very often a safe and sensible alternative to big pharma solutions. Trudeau's Liberal government wants to bog down the natural health product industry with red tape that would drive up costs and reduce access to natural health products that Canadians have been safely using for decades. NDP and Liberal supporters once big supporters of holistic, natural, alternative health solutions seem indifferent to the fact that the Liberal NDP coalition is now going after natural health products. So much so that Dr. Stephen Ellis, the Conservative Shadow Minister of Health, and Calgary MP Tom Kimmich issued a letter to Liberal Health Minister Mark Holland calling for these newly passed regulations to be postponed indefinitely. To learn more about these troubling measures and the impact that they would have, I was very fortunate to be joined by Dr. Rob Roth, the president of the College of Naturopathic Doctors of Alberta.
Everything from supplements to apple cider vinegar and green tea could be threatened by new Health Canada regulations.
It's a financial issue. It's an issue about self-choice. It's an issue about freedom of choice.
And we should not hesitate to tell Health Canada to go back to the drawing board.
There are many people around the world who have traditional remedies that they've been taking for generations. They may come from Europe, they may come from Asia, they may be indigenous, and these are all at risk.
The framework imposed prohibitive costs and will exclude women, minorities, and products that will support the health of females, children, and underrepresented people in our society. The natural health products is facing major regulatory changes under the broken self-care framework that will hurt innovation, jobs, and competitiveness in Canada.
It's worth noting that this is a huge bill containing dozens of tax and regulatory initiatives, some of which, frankly, deserved to be presented in separate bills. In fact, this was part of an observation at the end of our committee's report, which found this practice unacceptable.
We will also stand up against Trudeau's attempts to shut down natural health products. He's trying to shut those down. This is about nothing more than giving more power, more control to multinational pharmaceutical companies rather than letting Canadians have the freedom and choice to try different kinds of treatments. We need more freedom and choice, not less, in the health decisions that we make.
Very fortunate now to be joined by Dr. Rob Roth. I guess the first question I would have for you with these new restrictions that are being brought in is what sort of health products that people are using on an everyday basis might be affected.
Yeah, I think that it's quite multifarious. I mean, these health products are regulated through the national government and the National Health Product Directorate, and that really encompasses all of them. And so as it relates to the increased perhaps amount of compliance that's being asked of the supplement companies, the likely outcome of this is that it's going to force these companies to raise the costs themselves, which is obviously going to be felt by the consumer at the end product. And obviously, we have lots of inflation already, but I think that this is going to add to prices, at least in the natural health products. But it will be probably seen across the board when it comes to health products, from my understanding of this.
And so for folks out there who maybe don't know, and I mean, I didn't include myself among those, what is the sort of distinction between like pharmaceutical and health product? Is this over-the-counter vitamins that are going to be affected? What exactly falls within this sort of non-pharmaceutical natural health product category?
Yeah, natural health products in Canada are regulated extremely tightly. In fact, we have some of the best, or you could just say the tightest regulation in the world. And really, to put a natural health product to market, you have to go through a number of significant steps. To do so, I couldn't just start up a health product company out of my backyard or in my garage and start putting supplements together and then selling them to the public. Right. You have to have, honestly, multi-million-dollar, really good manufacturing product facilities. So these are GMP facilities that are certified by the government. Yeah. Your samples actually have to get tested and sent to labs for verification and so forth. And that's really, honestly, very similar to some of what needs to happen from the pharmaceutical side. And so in Canada, you're actually, you're really, I think, guaranteed is to have a product that is what it says it's going to be as a result of the current Natural Health Product Directorate system that we have in place.
And so what falls into this category, though? Like, would it be vitamin D? Right. Would it be fish oil? Would it be protein powder? Like, what are the actual examples for folks at home?
Yeah, all of those. If you can think of a supplement, it's it. So botanical supplements, for instance, whether you're talking about St. John's wort or echinacea, vitamins, as you say, vitamin D, vitamin C, anything that you're really going to be buying out of a jar, so to speak, that's getting packaged, it ends up falling under this purview. So really, it's pretty ubiquitous when it comes to the supplements that you would just normally think of. And that's distinct, obviously, from food categories. But as you say, certainly vitamin D and what you might consider these banal products are captured in this, if that makes sense.
And my question for you would be, like, most of these products are things people have been using for decades, sometimes thousands of years, literally. They're safe and effective, likely, as long as, assumingly, there are sort of safeguards and standards in place, as you've mentioned. What could prompt this? What's the motivation for bringing in a bunch of red tape, restrictions, and regulation? Is there like a concern? Has something happened that could prompt this?
Yeah, it's a really good question. I mean, I think on its face, at the surface of this, it's not unexpected that you might say, hey, like, why don't we create more regulation to ensure the standards are just, the absolute best, which candidly, my understanding of the market is that we do hold some of the highest standards globally, if not perhaps the current highest global standard. I'm not sure about that for fact, but it's certainly very high. And so to your question about like, why add more? It's like, well, sure, why not make things safer, so to speak? But I think it begs the question, well, is there an issue with the current system? Are there actually supplements that are problematic in the current model? I'm not really sure there are. I mean, certainly, like I say, there is a level of onerous nature by these companies already to have to comply under certain rules. Like I say, there's not really this flippant attitude that you just are amalgamating, bulk product and putting it in capsules without actually being tested or being done under good manufacturing practices. So I can't really speculate, I mean, I think that I suppose this does historically happen, like people want to create control. They think that it would be the right thing, but I think that it oftentimes isn't necessarily understood from the opportunity cost on the other side, which is what is the problem, or what is the potential consequence or downside consequence of that. And in this case, I think there's a likelihood that we're going to see a consolidation of players in the market, which is going to squeeze out smaller players who might not be able to afford to play in this space. Again, that is all of the costs are going to be forwarded onto the consumer. And that obviously leaves them with less access to medicine, essentially, because these are medicines at the end of the day that we're dealing with. And if we're reducing their access to this, there's a cost to that. It's not to say that we don't need to find a balancing act. We certainly do. Right. But in terms of the motivation, it's tough to say, given the current landscape being so, we already have such a high standard, like I was saying.
I'm Dr. Peter McCullough. After years, I'm finally coming to Canada.
I'm a practicing internist and cardiologist. I've trained in epidemiology.
The FDA wanted to block the Pfizer dossier for 55 years.
50% of the lives at that time could have been saved. We were at about 250,000 deaths.
Red Deer, Thursday, November 9th. Get tickets at canadiansfortruth.ca. See you Thursday, November 9th.
Well, and I think you touch on something there, because very often I'll see, whether it's my doctor or my naturopath, they'll say, oh, well, you know what, this product is really, really good. Sometimes it's a bit niche, it's off market, it's a smaller company making a really high product. They may not be able to afford to keep up with these restrictions and regulations. I suppose as a follow-up, often red tape, the intentions are good, but the outcomes are not. Is this mostly red tape, or like there isn't an incident that comes to mind, like, oh, there was this botched batch of something and a whole bunch of people got sick in very recent history, or anything like that?
Not that I'm aware of. I don't know that there was. That would actually be a pressing question that I'd like an answer to myself. Is well, what's the impetus behind this legislation? Have we failed, and has the current netting that's there, does it have holes in it that need to be shored up? I'm not really sure that the answer is yes. But I mean, candidly, like, this obviously is a mechanism for the government to get money back on it, right? My understanding is that the supplement companies are going to have to pay more to be part of this regulation. And so, I mean, that's a way for the government to capture some of that money back. And we've certainly been in a monetary expansion moment. And so to go back to your question about motivation, perhaps, there's motivation to try to recapture some of this just from a budget perspective. I'm not an economist, but cost of capital is high and the government has a lot of debt, and you need money. And
that's incredibly interesting, because you look at another field, like, for example, the control on social media that we saw with Instagram, Facebook lashing back. Part of that, while it seems like just a control red tape mechanism, there's also the fact that they'd be clawing back money that they'd give to these agencies instead of giving the money back themselves. So that's very interesting. Speaking of money, I suppose, just how sometimes natural health products are a cheaper alternative. Sometimes it can be quite costly. But just how much will this literally potentially drive up costs, and could it also, with people getting knocked out of the game, affect supplies?
Yeah, I think potentially very significantly. I think both are true. I think that you're likely to see something that you mentioned, which is relevant, that we're probably going to see a number of products that will no longer exist as a result of the cost structure increasing and just basically not making economic sense for companies to carry. Again, I think some of those smaller players will end up getting knocked out of the market. I mean, already what we're seeing is that a lot of the major players in supplements are actually owned by the pharmaceutical industry. And that's not to say that that's a good or bad thing. It's just the fact. But I do think that more competition in the marketplace tends to be good. It also drives innovation and allows companies to, or incentivizes companies to go out and develop medicines that are, novel, better, more research, more money gets kind of into that. And I think that when you lose that, you can create a bit of a complacency in the market. And so I do think that there's, at the end of the day, the long arc of all of that ends up feeding back to be potentially quite negative on the consumer, who's the patient, who's the Canadian. So yet to be determined, but I think that those are some potential arcs for this.
Well, I know lots of folks are concerned, especially how cold and flu season is coming upon us. Lots of people are like, I'm going to get my vitamin D and get loaded up on whatever else their naturopath may advise. But the potential of losing out on that, or not having that available, or having the cost on that skyrocket, is particularly pressing right now. But it's interesting, going back to even like my childhood up until just about now in history, there's been a major sort of impetus to move towards preventative, sort of holistic, even Eastern, some used to call it, type treatments. Often naturopathy intersects with that very much. On the other side of this, so it's interesting because we've seen sort of treatments for various illnesses come along, be expedited, which you probably know what I'm talking about. But is there a shift away with the government implementing new regulations on these natural health products and then sort of rushing other major big pharma solutions through? Do you think it signals like a shift in the general approach to healthcare from this government?
Yeah, it's tough for me to answer that very, very clearly, honestly. I mean, being in Alberta, I'm actually quite buoyed by the current landscape, honestly. I think that our government is taking some some really concerted efforts to shore up potential deficiencies in the healthcare system and bolster it, provincially speaking. And to answer your question there, I mean, because of that, obviously healthcare is jurisdictionally regional. I'm optimistic about the place. I actually think Danielle Smith and I think Adriana Lagrange are doing some good things in allowing choice in the marketplace for healthcare, which is just to say that patients still have access to us. As it relates to the bigger scope on the national stage, yeah, I mean, it's difficult to know for sure, Yeah. I mean, I think naturopathic medicine has a big role to play in the way that we can deliver care in healthcare, in healthcare, and I think that the more that we embrace that, the more that the federal government would embrace that. But really, where at the grassroots, I think this happens is at the provincial level. I think the better we can implement it. And, even like jurisdictionally speaking, we look at a jurisdiction like British Columbia and they've got quite a bit of rights. They have full prescribing rights. They have access to ultrasound guided rights for their injections. And I think that offers people more access to care. And this is the same thing with the supplements is that, you want to give people an opportunity to have choice in their healthcare and also be able to deliver healthcare that's meaningful to them as a person, but also diverse, honestly, in the landscape. So I think in one sense, you're right. Like if we limit the entire supply of kind of our natural health products, or if that's the potential of what's going to happen, that's really the likely, I think, consequence that may happen here, is that I don't think that that's really great. But I think that on a whole, there's opportunities even regionally to kind of help bolster the healthcare system so that patients still have access to good care, have access to good medicine. So despite what's happening in more of the federal landscape, I am buoyed by the provincial potential.
Well, and I think you touched something, the notion of subsidiarity, like reduce it to the smallest level possible. Danielle Smith was recently asked about her medical history, and she said that's between me and my doctor. I think that sentiment of supporting doctors, obviously have safeguards in place so people aren't getting questionable, unclean, dangerous, whatever it may be, medicines, but enabling doctors to treat their patients responsibly with the treatments that they're asking for. I think that is critical and important. I suppose finally, specifically for your industry, I'm sure you're approached by plenty of patients who maybe have been failed by conventional systems or are struggling or haven't been able to find a solution. And very often sort of naturopathic means, time-tested means are the solution that help them. How much do you think that this potential shift could affect your industry and your profession?
Yeah, I mean, I think immediately, like I talk about this with patients in terms of their own healthcare, I say, hey, there's short arcs and long arcs. And the short arc of this is that, I don't think it will have too much of a consequence, but I think the long arc is that it could have a very significant impact. And what I mean by that is that, on its face, it doesn't seem like it's going to be much. We might just see some small movements happening, maybe some loss of some companies, and we don't really see that affect us in the short term. But the long term, again, I think goes back to the fact that if we don't have access to a robust amount of medicines with really open marketplaces that allow for these companies to compete at a grassroots level, at a large level, at a medium level, I think that, yes, I think at the end of the day, it's patients that end up suffering, whether it's due to rising costs of their medicine or whether it's due to the fact that they just don't have the selection. We'll see, I suppose is the only thing I could say at the moment. Time will tell.
Well, I do want to thank you. Often we talk to politicians or we talk to the people making these decisions, but talking to someone who works with folks, helps folks on the front lines and experiences the firsthand, I think it means a lot, and I'm sure our viewers will really appreciate it. So Dr. Rob Roth, thanks so much for your time, and for everyone at home, I want to thank you so much for tuning in. For Rebel News, I'm Adam Sos. The Liberal government does not want you seeing conversations like these. That's why they're going out of their way to censor social media. You may have noticed that some of our content, well, it simply isn't appearing on social media anymore, particularly Instagram, Facebook. If you want to access our content, very often you need to do so via a VPN. Well, I want you to go to stopthecensorship.ca right now. At that location, that website, you'll be able to sign our petition. You'll also have access to a really great deal on a VPN if you don't have one, so you can continue to access our content. So sign the petition, get a VPN at stopthecensorship.ca.